Okay, I'm going to do some Snagit videos called How to Find It. And I'm not sure how else to label these, but as you go through your textbook and you are looking at the examples that are in the book in those little purple boxes, if you cannot figure out how they got to the codes that are there, I want you to send me a forum request, and ask me to please do a Snagit on how to find the codes for the example on page, in this instance it's page 123. And then I want you to type the scenario out in the question, and I will go in there, and that's how I'm going to label these. I'm going to label them Snagit, how to find it, and then the page number in your textbook. Okay? So this particular one is found on page 123, and the example says, at term, patient at term, 40 weeks, with obstructed labor due to breech position. Lower segment cesarean section was performed with a delivery of a single live-born infant. So here's how I tackle these, and this is probably going to be the easiest way for you to do it, because as you get into coding deeper, you're going to be doing a lot of, there's a lot of information that's just extraneous information that you don't need, okay? So let's look at this. So the first thing that we have, and remember I said at the very beginning of the semester, break it down. If you've got something there that's got tons and tons and tons of information, and there's just so much there and you're just overwhelmed, stop, take it sentence by sentence, or section, or sentence fragment by sentence fragment if you need to, and break it down, okay? So that's what I do when I'm coding. So the first thing I'm going to say is I have a patient at full term, right? She's at 40 weeks. She has obstructed labor. She has a breech presentation. Okay? She has a single live-born infant. And then her procedure is that she has a lower segment C-section. Okay? So, do we have everything? Yeah, we do. We just don't have the patient at the, is, with, all of that. We don't have that. We have just broken it down to the very base, the very root of what we're looking for. Okay? So let's get our book out and start hunting these down. Okay? All right, so the first thing we have to think about is, she has what? What is going to be our principal diagnosis here? Well, why did the woman come in? Did she come in for obstructed labor? No, she didn't. She came in for delivery, right? Do you remember when I said if you deliver a baby, that's your principal? She delivered a baby. That's what she did, right? So let's look up maybe delivery as our main term, okay? So if we look up delivery, and I pre-marked these so that we can move through them, okay, a little more quickly. So we're at delivery, okay, and if you look, we know that we're going to have fifth digits because this little box is telling us, right? And we know that we see a lot of these red dots. That's telling us what? That we are going to have additional digits that we have to use. So let's look right here. Bang. The very first thing we have is breech. Did she deliver a breech baby? Yes, she did. It doesn't matter if you deliver it C-section or vaginally, you've delivered a breech baby. Okay? So we have a breech baby, and all of our non-essential modifiers, they don't matter. We have not delivered a breech baby that affected the fetus or newborn. We don't know. And we did not use extraction. Now, by extraction, don't confuse going into an incision and taking the baby through a C-section as an extraction. By extraction, we mean forceps, vacuum extraction, something along those lines. All right? So if you look, we're going to go with our default code of 652.1. Now, I want to show you a couple of other things very quickly. What kind of procedure did she have? How did she deliver the baby? She delivered the baby by cesarean, did she not? Now, if she delivered the baby by cesarean, I want you to start looking. It says, the subterm says abnormal. Then we start to see abnormal pelvis, right? We come up here to the very top. We're seeing abruptio placentae, acromion presentation. So let's look and see what we get if we look for breech. And there's breech right there. Breech presentation. What is that code? 652.2. So it's the same code as we have down here, right? Okay. So let's think of one other place that we might be able to look. I would look under breech. So let's look under breech here. If we look under breech, do we find anything? Breech, delivery affecting the fetus or newborn? No. Extraction? No. Presentation? Yes. With successful version? No. Meaning, were we able to convert to the baby being head down instead of butt down? Before labor affecting the newborn? Or during labor affecting the newborn? No. So we're going to go with our default code for this presentation, which is, look at that, 652.2. All right? So let's go to 652.2 and take a peek. Okay? Let's just look and see what we have here. All right. So here we go, 652.2. Okay? 652.2 says breech presentation without mention of version, and underneath it says breech delivery assisted spontaneous and otherwise specified. Buttocks presentation, complete breech, frank breech. Excludes footling breech or footling presentation and incomplete breech. Okay? So if you look and you're a little confused about what all those things mean, although you shouldn't be because you should have looked it up by now, right? But they have pictures here, and A is the breech presentation. See the baby's behind? A footling would be where the baby's foot is coming first. So the baby's one knee is up and the foot is down, or their feet are both down. That's a footling, okay? So we have 652, okay? But what do I tell you you always do? First, you always, before you code for sure, go back up now to your category and you read that, malposition and malpresentation of fetus. Then you read anything that's between that and your first subcategory. So we have, requires a fifth digit. We did know that because it has our little visual cue of the stop sign, right? We also had the blue box in our index, our alphabetic index, to warn us ahead of time, and we had our little stop sign in the alphabetic index. So we know that we have to have a fifth digit. The valid digits are in brackets under each code. So what does that mean? That means here we have these little brackets right underneath the code, 0, 1, and 3. So that means that we need to go to the blue box here, and all of these apply. These apply to all 650 through 659. Okay? So if you see your little brackets here, that means you need to look for one of these blue boxes. And then you need to read and make sure right above it will tell you the following fifth digit subclassification is for use with categories 651 to 659. Okay? So 0 is unspecified as to episode of care or not applicable. 1 is delivered with or without mention of antepartum condition, and 3 is antepartum condition or complication. Well, what do we have? We have a patient that delivered, right? She delivered because we have a single live born infant. She's new, she's full term. We don't know any complication that's antepartum or condition. That would be something along the lines of gestational diabetes, placenta previa, preeclampsia, something along those lines. All right? So we are going to pick one, are we not? 652.21. Now, that's our code, correct? So that is for our breech presentation delivery, 652.21. Now, I'm going to say this. I don't believe your book has this code in the example, but I want you to, I'm going to disagree with your textbook, all right, because I want you to go back to your 652 and continue reading because there's more. And what does it say? Code first, any associated obstructed labor. Do we have obstructed labor? We do, don't we? So it tells us to go to 660.0. So let's go to 660.0. And when it sends you to a code like that, or it says code first or code additional, you don't have to go to the alphabetic index. You can go to the code ranges or the code that it gives you, okay? Now, what does this tell me? 660.0, obstruction caused by malposition of fetus at onset of labor. Is that what we have? Well, let's read it. Any condition classifiable to 652, which we have, correct, causing obstruction during labor. Use additional code from 652.0 to 652.9 to identify the condition. All right, so that means that the condition she had was the was the breech presentation. However, she had obstruction due to that. Now it's telling us up here, if we go to 660 again, because we've gone here 660.0, now we need to go back up to 660. Requires fifth digit, valid digits are in brackets again. So that means that we see these little brackets. We need to look for the blue box somewhere ahead of it. It could be pages and pages that you're looking, but here it's right above it. Following fifth digit subclassification is for use with categories 660 to 669 to denote the current episode of care. And what do we have? Again, delivered with or without mention of antepartum condition. So, we have 660.01. All right? That's what we have there. Now, do we code the full term? No, we do not code the fact that she's full term. Okay? What do we have to code next? Now we have to code the fact that she had a single live-born infant. Where are we going to look for that? Well, our main term in that is outcome. That is an outcome of delivery. So we're going to go to outcome, main terms, and if you look right here, outcome of delivery, and it tells us multiple birth, single birth, twins. So we have a single, and then you choose whether live-born or stillborn. Do we have a live-born? Yes, we do. We have a single live-born. So let's go to V27.0, because again, what do we never do? We never, ever, ever code from the alphabetic, even if you know it beyond a shadow of a doubt. Okay? So V27.0, outcome of delivery. Note, this category is intended for the coding of outcome of delivery on the mother's record, V27.0. Okay? So, we have V27.0. The last thing we need to code is the lower segment C-section. So, we're going to go to cesarean section. It's as simple as that. And that is right here, cesarean section. Okay? And remember, we don't go to section, go to cesarean, and we go to cesarean because it's an eponym. It's named after Julius Caesar. It's an eponym. Okay? So, we go to, we have all of the different types. Look at that, low uterine segment. 74.1. So now we're going to go to 74.1 in our book. And here we have low cervical cesarean section, lower uterine segment cesarean section. Up here it tells us under 74, cesarean section and removal of fetus. Code also any synchronous hysterectomy, myomectomy, or sterilization. So if for any reason when they did that, perhaps the uterus was torn and shredded so badly that they needed to do a total hysterectomy, you would code that as well. Perhaps the myomectomy, they needed to take the lining of the uterus. Perhaps they needed the patient wanted a sterilization. It's Mrs. Duggar. It's her 21st or 20th child, and she's decided she doesn't want any more. All right. They do a sterilization at the same time. You would code that as well because it says any synchronous, which means done at the same time. Okay? So your code for your C-section is 74.1. Now, how do we sequence these? Well, we know that it told us to code first obstructed labor. So, we're going to sequence them 660.01. The breech presentation is 652.21. The delivery outcome is V27.0, and our procedure is 74.1. All right? That's how I found all those. That's how you will find those. Okay? So if you have any more, shoot them out to me. All right? I will see you soon.